Hi, Rebecca.
Hi.
Hey, let me make sure I don't need to let anybody in here. Okay, I think it's just us right now.
Cool.
All right, so
you're gonna be recording, right?
it's already recording.
Awesome.
All right, cool. It'll be a smaller group today, I think, since we didn't have a lot of time to mark it, but I'll go ahead and share the screen.
Okay.
Let's see. All right, welcome everybody. This is our second try. The first try didn't record, so we're going to do another round. So thank you for being here today. We do a lot of monthly workshops like this, just free workshops to kind of help with different things that we deal with IBD. And I'm Ashley Hurst, and this is, you want to introduce yourself, Rebecca?
Yeah, I'm Rebecca Goodrich Dowd.
I still spelled it wrong.
Okay. I'm also a registered dietitian with the Crohn's and Colitis Dietitians. Yeah, so let's go ahead and get started. So really excited to be with you all here today, and hopefully, this is helpful for you, and you definitely learn something from today's presentation. And just a side note, I have ulcerative colitis, so definitely understand everything that kind of goes with having IBD. And I have shared in the past too that my husband has Crohn's disease. So so definitely understand. And you guys are just so not alone. So just wanted to, preface that, and just before we started, just so that you guys know that. So we're talking about misconceptions. And, when we see this first one here, I'm sure we've all heard this before. I've heard this before, that number one, fiber should be avoided. And so this is a huge misconception where we have been taught throughout the years that we really need to focus on low fibrous foods, because, fiber is not good for IBD and it can make the condition worse. And, all these things that we've been told throughout the years. And so we want to just really clear the air with that misconception, and just really, and everything that we're saying today is backed up by research. So what we do know about fiber is that the byproduct of fiber is called short chain fatty acids. And there are three different short chain fatty acids. They're butyrate, acetate, and propionate. And so the most, I guess, popular short chain fatty acid that we're hearing about is butyrate. And so short chain fatty acids, they provide many health benefits to the colon. So they really feed the colon, and they provide energy to the colon. And what we do know is that they help firm stool in order to minimize inflammation. So that's the first thing that we know about short chain fatty acids coming directly from fiber. The other thing is that a high fiber diet can help lower inflammation by changing the permeability of the gut, which is very powerful. So what we know about permeability is that this can lead to what's called leaky gut, which maybe some of us have heard of this before. And so it's really important that, we avoid any kind of intestinal permeability, because then absorption gets a little wonky. Our IBD can become a little bit more symptomatic, and this is what can lead to flares. And so the high fiber diet can actually help lower inflammation, and therefore can change that leakiness of the gut. So we know how powerful fiber is in that perspective. Fiber can help maintain a healthy microbiome and mitigate dysbiosis. And so dysbiosis is having an imbalance of bacteria in the gut. And so we tend to see more of the unhealthy bacteria rather than a healthier bacteria, just to kind of make it easier to understand. There are different types of bacteria that has been shown to contribute to flare-ups, or things that we know, are a little bit more in overabundance in patients with IBD. We tend to have a higher bacteria that it's more unhealthy for the gut rather than healthy. So that's why we want to feed ourselves with more of this high fibrous foods, because we're able to incorporate a healthier bacteria, a healthier microbial environment. And so that's what that basically means when we say that fiber can help maintain a healthy microbiome. And then participants with Crohn's disease who reported of not avoiding fiber, so meaning they were consuming fiber. So those that reported of not avoiding it were 40% less likely to have a flare compared to those who avoided high fibrous foods. So we know that fiber can definitely play a role in decreasing the onset of flare-ups, which is also very big. So tips for reducing symptoms with fiber. So I'm like thinking fiber. So tip number one, when in doubt, go low and go slow. So if you have Crohn's and you have a history of narrowing or stricturing, that's where fiber gets a little bit more specific. So fiber is categorized into multiple areas. As far as the fiber goes, it has to do with its fermentability. It has to do with the solubility. It has to do with the chain of the fiber, the absorption of the fiber. So it gets very specific. And so what we know with narrowing and stricturing is you don't want to just stop consuming fiber, but instead you want to focus more on soluble fiber. So that's where it gets a little bit more specific for you. Now, when in doubt, you want to go low and slow. So maybe this could be trying one, fruit or one vegetable at a time, depending on what your situation is. Side note, this is why you definitely want to work with an IBD focused dietitian, so that they can help navigate your tolerance and they can keep track on you, right? See how you're doing. So you want to give yourself some time, because food intolerances can change over time. So, maybe during your flare up, let's say that brown rice you consumed was giving you cramps, you weren't feeling too good. And then all of a sudden, 3 months later, after taking prednisone, after feeling a little bit better out of your flare, you start to reincorporate some of these foods, and maybe that brown rice is really no longer giving you those cramps, right? And so, or having diarrhea. And so, intolerances can change over time. They're not the same as food allergies. So very different there. Try changing the way you have the food. So instead of having raw spinach or kale, try having it sauteed or in a smoothie, right? And so that's where we get creative with you guys, because what's important is it's not so much of, okay, let's never have kale ever again. Let's never have spinach again. Instead, let's change up the way it's being prepared so that you can tolerate it better and so that you can reap from the benefits of these foods. When we look at raw almonds, instead of having raw almonds, have the almond butter. As far as beans go, perhaps cooking them longer or adding baking soda to them so that they're a lot easier to tolerate. My favorite thing is hummus. So consuming hummus can be a lot easier for you to tolerate. And then as far as the kale goes, we know that kale is it's pretty rough, right? So, when you look at kale, you kind of think, oh, like this is what my digestive tract needs to break down. So what you can do to make it a little bit easier is to de-stem them, meaning cut the stems off, right? And kind of, you can even rip apart the kale so that you don't have to break down that long, thick stem that's in there. You can also saute the kale, massage it, because what we know is when we start sauteing and massaging the kale, it starts to shrink. And so it makes it a little bit easier for you to tolerate. And also putting it in a smoothie so that the smoothie can kind of help pre-digest it. And you're still having some of that fiber. And then long-term, when you have the fiber long-term, we know it can decrease inflammation. And long-term, we're able to correct some of these deficiencies. All right, let's look at number 2 misconception. So this is a huge one. Symptoms equals flares. I mean, I don't know, maybe you guys can all raise your hand if you've ever felt this way, but I will go ahead and raise my hand where any kind of symptom that I felt, yeah, exactly, Ashley. And Ashley and I have talked about this together too on our podcast, but anytime you see something or you feel something, you're like, oh my God, am I going into a flare again? Like, please no. So, we can definitely all relate to this feeling. Just so you know, really important to remember, just because you have a symptom does not mean that you're in a flare-up, nor does it mean you're getting into a flare-up. So let's kind of take a closer look at this. So normal or healed colonic mucosa, which is seen during a colonoscopy, can be seen while the patient may still experience abdominal pain and diarrhea. So that's why just because you're symptomatic of some sort doesn't necessarily mean that you're inflamed. There could be many reasons why you're still being symptomatic. It could be possible IBS, it could be dysbiosis, it could be stress-induced. There's just so many reasons, right? So, and it's actually on the other end too. So patients can also have 0 symptoms, no bleeding, no cramping, no weight loss, no, fever, no, the symptoms that we know that come with Crohn's and ulcerative colitis. We can have none of those symptoms, and then doc can go in there, do an endoscopy, and they see inflammation. And you're just like, wait, what? But I'm not feeling anything. And so that's why it gets really tricky, because it goes both ways, which is also the reason why you do not want to skip your scopes. Make sure you're staying on top of that. And some patients can also show no clinical symptoms, right? So no cramping, no bleeding, nothing like that. Moderate histological inflammation, meaning after your scope, the pathologist looks at the biopsy and sees that there is moderate inflammation there, and have an elevated C-reactive protein level, which is an inflammatory marker. So what does this all mean? This means that you can show inflammatory signs from your labs and from your history of your IBD, but have 0 symptoms. So it works both ways. And then, so when we look at symptoms versus inflammation, so just remember that when a food triggers your symptoms, let's say you're having quinoa, brown rice, a vegetable, apple, and you feel something, just because you ate that, it doesn't mean it caused your IBD to be inflamed or anything like that. So we know that there's a difference between irritation versus inflammation. 2 very different things. When a food triggers symptoms, it doesn't mean it caused your flare. It also doesn't mean that it's causing harm. So it's something to remember. But this also doesn't mean that nutrition and food that we eat don't matter or play a role, because we know that nutrition is crucial for IBD remission, to correct deficiencies, to prevent malnutrition and other things. We also know that this doesn't mean food patterns. Well, we certainly know that food patterns are important, but we can't always tell with symptoms alone. So we can't pinpoint where we are with our IBD by looking at symptoms alone. We got to look at the whole picture. Misconception number 3, you have to choose between meds and nutrition. Okay, so you definitely do not want to choose between one or the other. We need both, okay? So if your friends, best friends, colleagues, cousins said, hey, I have IBD and I stopped taking medication because I worked on my nutrition and it's gone, that person is incorrect. That is not true. So there is no known cure at this time for IBD. And so this is why you need both medications and nutrition. So the most important thing that we want to look at is the end goal. So what is the end goal that we're trying to aim for? Also, most studies, they actually look at nutrition and medications together. So things like mesalamine, which is a 5-ASA, usually we'll see research using 5 ASAs plus some sort of nutrition plan or looking at a biologic plus some sort of nutrition plan. So it's really not one or the other. We really see them work synergistically because that's how we get better outcomes, by utilizing both. So never stop taking your medications, unless directed by your doctor, of course. Nutrition is personalized just like your medications are. So, when you work with your IBD focused dietitian, your nutrition plan is catered to your lifestyle, it's catered to your IBD, it's catered to your food allergies, intolerances, etc. So everything gets so detailed and specific. And something important to remember also, just like with medications, there's no guarantees. So, we have a lot of different medications, which is great because then we can figure out what works for us and what doesn't work for us. But that's the same it's the same with nutrition. So, we can say, okay, you want to do this, eat that, work on this, but it doesn't guarantee that we're going to get into, deep remission or, whatever that may look like. So it's important to know that that medications and nutrition are both important together. Number 4, nutrition doesn't matter. So as a dietitian, I'm going to say nutrition does matter. So we know that the way that what we see in the research is that nutrition is crucial for remission, for mucosal healing. It's something that I know Ashley and I can talk about for hours. And so what we know is with IBD, there is increased risk of malnutrition and deficiencies, which in turn makes it very difficult for the body to heal because we need to correct these deficiencies. And we want to make sure that we're utilizing the gut when we're able to. We also know that with nutrition, it allows us to heal. So in pediatric patients with Crohn's disease, we know that utilizing exclusive enteral nutrition via oral route or through an NG tube, we know that that's the first line of treatment to induce remission. And they compared this to a steroid, to prednisone. And we also know that correcting deficiencies, as mentioned previously, can help us get into remission and decrease surgical complications. So it's so important. And this is not just IBD, surgery. This is just surgery in general, that when we correct any kind of deficiency and prevent malnutrition, we have better outcomes in surgery, which is really crucial. And then dietary strategies can help the GI mucosal barrier and microbiome. So when we support your microbiome, when we focus on healing that mucosal barrier, what we do know is that nutrition can really play a role in that healing process. So let's look at what the research says. So this is from the IO-IBD. And so basically what they have recommended, and there was an article that came out in 2020, I just revisited this a couple days ago, and it really, it explains, what's beneficial for Crohn's versus ulcerative colitis and what they recommend between the two together. And they're pretty much similar. And so what we know is that we want to reduce and limit intake of red meat. We want to decrease intake of myristic acid. And so this usually comes from tropical oils such as coconut oil, palm oil. We also want to really limit our intake of dairy fats. We want to increase our intake of omega-3 fatty acids coming from food sources like salmon, walnuts. We also want to lower saturated fat intake, which are usually fats solid at room temperature. So usually going to be our dairy products, usually going to be our animal proteins, things like that, like chicken, red meat. So it's not so much of never eating this again. We just want to make sure that we're lowering your intake of saturated fat. And we want to decrease intake of certain additives and preservatives. So when you see the chart on the right, and it's interesting because I know with ulcerative colitis, there's not a lot of research regarding fiber, but I do know that that's going to change. There was a research article that recently came out specifically on ulcerative colitis, showing the benefits of adapting a lower fat diet versus high fat and increasing high fiber intake for better outcomes on ulcerative colitis. So we know that low fat, high fiber is actually very beneficial to the microbiome in patients with ulcerative colitis. So when we look at Crohn's disease on the left, again, we want to lower saturated fat, trans fats, emulsifiers, carrageenans, artificial sweeteners, maltodextrin, and titanium dioxide, which is the same with UC. So they're both pretty similar. So what the research says, so we want to increase our intake of fruits and veggies. Why? Because diversity is key. So all those different colors, they all provide different nutrients. Tomatoes, blueberries, strawberries, kale. There's so many different vitamins and minerals that are really coming from these foods. We want to include whole grains because they're important for us, and there's also some antioxidants in there as well, and they're great sources of fiber. And we want to increase fiber intake because it can improve quality of life. And remember that butyrate we were talking about earlier, it helps with butyrate production, which this is the healthier bacteria called Faecalibacterium prosnitzi. I'm probably pronouncing that incorrectly. And it helps lower inflammatory markers. So another reason for that. So what the research says, so diet plays a role in the development of IBD. That is very true. Diet plays a major role in symptom reduction, which is also very true. Certain foods can decrease risk of flares. Certain foods can increase your risk of flares. And remember, it's all about the patterns too. So let's say you're like, oh no, I had coconut milk this morning, I'm gonna get into a flare. No, that's not true. Now, it's more of, looking at the bigger picture rather than one specific thing that you've done. Nutrient deficiencies and malnutrition increase risk of complications and surgery, absolutely. Some nutrient deficiencies are correlated with severity of flares, yes, absolutely. And vitamin D plays a role in regulating inflammation, and 30 to 40% of IBD patients are actually low, which is why it's important to monitor those levels. So the facts, so why nutrition matters. So kind of looking back again on our pediatric Crohn's patients, the first line of treatment is nutrition to get into remission. Diversity of plants is crucial to gut health, largest microbiome study. Those that keep fiber in the diet are 40% less likely to have flare-ups, just like when we looked at our Crohn's patients. IBD patients often struggle with including diversity due to fear of triggering symptoms. And this is where we come into place because we're able to help you navigate how and when you can implement these fibrous foods to make it easier for you. Also, something that I love doing is challenging food fears because I like to really help navigate that to make sure that we're keeping a healthy relationship with food. That's so important. Also, 80% of IBD patients have disordered eating and fear of food, which can add to symptoms, and IBD-focused dietitians can help with this. Yeah, and that's kind of what we were saying just a second ago is that, I want to make sure that my patients with IBD, we're approaching these food fears because, we want to have that healthy relationship. We don't want it to take over just everything. We don't want to lose the fun in food. And 1 in 4 patients have an eating disorder with IBD. So what we know about nutrition and IBD is that there is not one diet that will fit everyone's needs. It's just not going to happen. Everyone has a different background, culture, and so there's just not one for everybody due to disease activity and location of the disease as well. So if your ileum is affected versus your colon or your sigmoid colon or your duodenum, your nutritional needs are going to vary because there's different absorption sites for each vitamin and mineral. So we need to hyper focus on that. And that's why it's different. Individualized approach is best. So tolerance, deficiencies, symptoms, inflammation, and other important factors are really important for us to look at. There are no quick fixes. So anytime you hear someone say, you do this and you're better in 1 month, that's false. So I like to say that it's not a sprint. It's actually more like a marathon where you want to take time and, know that it's going to take some time to really heal yourself, especially if you're coming out of a flare. And there, there is a lot of conflicting information provided to us at diagnosis. Hello, Dr. Google, right? How many times have we gone on Google and Googled, okay, why, where is this coming from? What do I do? So there's a lot of conflict there. And so, we see that also throughout our journey. So it's really important that you work with a team that specializes in IBD so that you get clear-cut answers, they're looking at the research and so forth.
And speaking of that, so has anybody ever felt overwhelmed, by all the information? So when you're first diagnosed and you're searching the internet and you type in what to eat for IBD and you get all the things of what not to eat. If anybody, I see a couple hands on here. Okay, cool. Yeah. This is like the number one thing I hear on inquiry calls with people is they're overwhelmed. And this picture on the right is actually my brother. If anybody wants to hear the story of this picture, we can talk about it at the end. But, one of the most important things I think in IBD nutrition is helping you to reduce overwhelm so that food is less stressful, because this is actually one of the big stressors of IBD is navigating the food, especially when it can kind of feel at times like everything we're eating is causing pain. So we want to help, we want to help our patients and those we work with decrease some of their fear and overwhelm around where to start. So here's kind of what we know. A lot of people get overwhelmed too with even just everything we talked about. If we were to kind of condense down, what are the most important things? I think the biggest piece of advice I could give is, instead of focusing on what to restrict, focus on what you can add to what you're already doing. And starting there will help you feel like you're going somewhere. It'll help you feel less restricted, because the goal isn't restriction. Restriction has downsides too. We don't want to just eliminate every single trigger and everything. We want to focus on what we can add. So increasing intake of fruits and vegetables is actually the first place to start. And I know that's scary for a lot of people. And if that's you, just know that there's a lot you can do, like some of the things we already talked about, to kind of help reduce some of the symptoms that are there. And everybody has a different starting place too. Some people we work with are starting from the hospital and can only do liquids. And some people we work with have a pretty diverse diet. So we just help them narrow down a strategy to reduce inflammation and further reduce symptoms. So another thing that I know Rebecca was talking about, smoothies and breaking food down as a way to decrease symptoms. I wanted to also say there's actually a study that came out in May of this year that actually compared cut fruits and vegetables to shredded fruits and vegetables to blended. So it actually looked at basically causing stress to the fruit or vegetable, and it actually increased the antioxidant capacity of that food. And this actually kind of makes sense, because with antioxidants, even when you have any sort of plants, when they undergo stress, they actually produce more antioxidants. So that's true with plants in general. And so what the study found was shredded, we'll just use carrots, for example. So cut carrots increase the antioxidant capacity by twice, and shredded carrots increase the antioxidants by 5 times. So the more that you cut or break down or cause stress, like in a smoothie, for example, it actually does not only improve tolerance, but you also get more antioxidants, which is really important when you've got IBD, because with IBD, we have a lot of what we call oxidative stress or damage going on, and antioxidants come in and help kind of clean that up and help our body recover. So that's just another thing I wanted to throw in. But with increasing fruits and vegetables, the diversity is key. So I know Rebecca said this on a previous slide, but what we know about diversity in the diet is that when they did the largest microbiome study, they kind of looked for a number, like how many different types of fruits and vegetables and plants and grains do we want to see in the diet? And they found that want to see about 30. So this was the largest microbiome study yet that looked at a large amount of people and kind of looked at their microbiome and what's the kind of ideal number. And so consuming 30 different types of fruits, vegetables, grains, plants helped. That was like the best case scenario for the microbiome. So trying to have, maybe a few different types of plants throughout the day, trying things you haven't had in a while can really help. And it can actually be kind of fun. You can keep things interesting. So maybe trying something that you're like, oh, what is that? And getting curious when you're at the grocery store, looking up different ways that you consume that food. Sometimes that can bring some of that excitement back to eating, and it can really make cooking a more enjoyable, fun experience when you get curious about food and you have a little bit more diversity. And then including whole grains. So people ask us about whole grains a lot. And in that study that looked at fiber, it looked at fiber in Crohn's patients. They also found that, consuming whole grains is beneficial for those of us with IBD. So it gets a little tricky if you have issues with gluten, for example, or you have celiac. That would be a whole grain that we wouldn't want to use in that scenario. But in general, whole grains can be pretty helpful at helping us achieve that diversity and helping us with reducing inflammation. And then increasing fiber intake. So we talked about this before, but this is one simple thing that you can do to really help. So I know with people that have strictures or different issues, we might want to modify the type of fiber but you don't necessarily have to take it out completely. Like we might want to change it to more soluble fibers or things that completely dissolve in water. But decreasing it completely can have a lot of downsides. So it can kind of be one of those barriers to you getting to remission and getting to a stable remission. So it is important for us to try to increase that. It can really help improve your quality of life once you get used to and adjust to fiber intake. So the rule of thumb really for fiber is going low and going slow. So starting low. So if you aren't used to having fiber, maybe don't just jump into like 30 grams at one meal. Maybe start with like, okay, I'm going to start with zucchini, maybe leaving the skins on, maybe adding in a fruit after the meal. And then, fiber really helps with decreasing inflammatory markers. So even things like leafy greens. So leafy greens is actually keeping leafy greens in the diet is correlated with something called decreased fecal calprotectin. So fecal calprotectin, you may have seen when your doctor orders like a stool panel. It measures inflammation in the digestive tract specifically. So it's a great measure of how we're doing with our IBD. Okay, so how to reduce information overwhelm. So I know there are a lot of things online. They often conflict one another. And so how do we take all this information? So especially with gut health and especially IBD gut health, there's a lot of noise online. Part of this is good because it means that, we're learning more about IBD and we're learning more about gut health. And it's kind of an explosive area of research. So there's a lot of stuff online. So how do we kind of narrow down to what's the important stuff? And not just that, but what's the important stuff for you specifically? Because, you can have a really important true information, but it may not be relevant to you and where you're at. So here's the thing. We need to have criteria for your information. So these are some tips that we have around kind of narrowing down what's good information. So one, does the person sharing have credentials? So are they specialized in nutrition? Are they licensed, for example? So a coach or even a nutritionist is going to be different than someone who's a dietitian who's specialized in the area, right? So I'm not sure how many of you are familiar with dietitians. A lot of people aren't, but we have to go through a board exam. We have to do an internship. We have to do several rotations in hospitals, in long-term care, to get a good understanding of how we can ethically and effectively treat people. The other thing that's important in that is that we have licensure. So we have someone to hold us accountable for the way that we practice. And I think that's important. That's really important in the big picture, because you definitely don't want to cause harm to people. And there are a lot of people speaking about nutrition who just aren't qualified to do so, including sometimes doctors who give advice that's not without much training in nutrition. So it's that, it's also coaches, it's also a random person in forums. Yeah, but just keep that in mind. So having some sort of credentials can also help kind of narrow down like who you want to listen to, if the information is valid. And then the other one is the credentialed person specialized in IBD? So is this their only focus, or is this one of many focuses? I think that's an important factor. So just because they're not specialized in IBD doesn't mean that they don't have something important to say, but it is more likely that someone that is specialized is going to be more up to date in the research in that specific area. Because I can tell you from experience that like if, even with us being very, very specialized and only seeing IBD, we still have a lot to keep up with when it comes to research. So every single day, I'm usually reading research, and then every week we meet as a team and we talk about research. So it's hard enough to stay up to date for us. So just keep that in mind, something to think about. And then 3, verify the credibility if working with someone or buying something. This doesn't have to be just working with someone. This could be supplementation too, right? That's the other area that we kind of get targeted as IBD patients. So for products, something to consider is it marketing selling me, or is there evidence? Is there actual evidence for what the claim is? Believe it or not, so I'm in the supplement industry too, and I can tell you that it's very easy to make something of low quality. It's a lot harder to make something that is higher quality and is ethical, right? It's a lot harder and it's more expensive. So keep in mind, like the supplement world is it's a mess. Like you do want to make sure that you're not being just marketed to, and there's actual evidence, and that particular product is useful for you specifically. So that's something you should ask your healthcare team about. And then with working with someone, you can ask questions too. So you can if you're thinking of working with a dietitian or a doctor, it's good to ask questions, or even a coach. What's their licensure? How did they get started? What's their goal of their business, for example? Those are all good things that you can ask to really gauge, one, if you align with the person, but two, to get to know their vision or what they're aiming to do in the space. And then know the difference between, this is huge. So know the difference between experience share and recommending evidence-based nutrition therapy. This is the most important thing. If you were to take away anything from this whole thing, I would take this. So a lot of what is shared online is more of an experience share. So experience share is great. Like I share my experience on Instagram all the time. But I try to also share like, hey, this is just my experience. It might be different for you. I don't know everyone I talk to on Instagram. So yeah, this is especially true on forums. So I see a lot of people experience sharing on even things like nutrition, and it can be good and it can be nice to hear other people's experience. I think experience shares are great, but when it comes to giving advice, so giving advice on nutrition or medication, we do have to kind of distinguish between, is that somebody's experience, or is there evidence for me to use this? So like I hear things like aloe, for example, like, oh, I tried aloe and it was great for me. Well, is that like, there's a lot of nuance to it. So with aloe, you want to know, for example, what am I using? What's the context of how I'm using this, or what type of aloe, or there's so many different things that an experience share might miss. And it might not even be appropriate for you to use that. Maybe you need to use something different. And then lastly, how is the information delivered and how does it feel? I think that's important too. So it's not just about the intellectual, like, if there's evidence, but we also want to know, how does this feel? Because something can sound really great, but we also want to know, how does it feel in our body? Does it feel terrifying? If it feels terrifying and it's kind of like fear mongering, maybe it's not right for us. So just something else to consider there. So I want to just check in with you and kind of get a feel for where you're at now. Are you, and you can type this into the chat too, are you A, feeling more relieved, less overwhelmed with the options that are available to you? Are you B, have you learned something about nutrition that you're excited to implement? Or C, change my mind about a misconception? Or D, you'd like to learn more about working with us? Whatever you're feeling, feel free to share that. I'd love to hear. I'm not even sure if I can see the chat here. Let's see. All of the above. Nice. A and D. Cool. Yeah. So for those of you that are in the last category, this is actually a great time to work with us because last year we had a bit of a waiting list all the time, especially in the early part of the year, and didn't have a lot of different ways that you can work with us, but now we have so many more options. So you can work with us one-on-one. We have kind of a group hybrid type of approach where you can work with us. We can support you all the way, or we can give you the tools and give you some support. We even have sliding scale options too. So there's a lot of different ways that we can support you. Yeah, so we offer long-term, high touch point one-on-one support. So as much support as you need over 6 months, that's one option that we have. We have shorter term, lower cost options that is kind of like that hybrid approach I was talking about. We give you a lot of the tools that we use in 6 months, and then you can come in and ask questions and get a little one-on-one support. And then we have low cost sliding scale options too. And then of course, we're always doing free content. We do these workshops. We're trying to do them about once a month. So far, we're on a streak of doing them once a month. We offer stuff on our blog. We just started a podcast called Gut Feelings Podcast. And then we also, I've talked a lot about that on Instagram. And then we have some free ebooks too. So yeah, I wanted to say, if you aren't sure kind of what's right for you, you can feel free to schedule a call, and let me go ahead and drop this in the chat too. And I'll also email this out with the recording. But if you want to schedule something now, there's the link. I'm happy to talk with you, and there's absolutely no pressure when we talk either. Like I want what's best for you, and that could be working with us, that could be working with someone else. I'm just really interested in getting you the care you need wherever you're at in your IBD journey. And Nicole is asking, I'm in Canada. Is it possible to be a client? Yeah, absolutely. So we do see patients in Canada. We even have a dietitian who is out of Canada too. So yeah, we'd love to take you on any capacity. Okay, we have another question. I'm in Canada. My 16-year-old was diagnosed in April 2022, trying to figure out the low FODMAP. I love your content on IBD, on IG. Yeah, thank you. Really appreciate it. So we're going to open it up to questions. I know we have a little bit of a smaller group than last time. So this is great for you. So you can ask as many questions as you want. We have a little bit of time to do that. So feel free to type them in the chat, and Rebecca and I will get to them. Yeah, and also while I'm waiting on some questions, so did most of you get here through Instagram or through, you also sent out an email newsletter. So just curious how all of you got here. We had a pretty big group on Monday. This is a smaller group because we didn't have a ton of time. Okay, Rebecca just said her fire alarm went off. So that's why she's not on here yet. That's funny because that happened to me last week too. Okay, Alex says Instagram. Cool. Yeah, does anybody have any questions on what we talked about, or what are some thoughts that you had, or mindset shifts? Okay, so we have Casey. She says, my doctor is currently recommending a change in medications. Would you recommend meeting with a dietitian first or then trying new medication, or doing medication and doing a new medication and dietitian? Yeah, it's funny. I get this question a lot. I'm not sure why they have to be separate. A lot of people sort of feel that way, but they really don't. So I think maybe, tell me if I'm wrong, but maybe the question behind this is it that you're trying to figure out what's actually working? I'm not sure if that's where you're at, but a lot of people think they want to try one thing at a time to see what works, but we don't have to guess about what works. We go off of evidence-based approaches. So usually with IBD, it's a collaborative approach. Usually there's more than one thing that we're doing with the ultimate goal of getting the results you need. So we help you with finding, okay, here's what we know that's already been tested. So you don't have to guess at what's actually working. We're usually using more than one thing that we know is effective to get the results that we want, including doing medication alengside dietary strategies, alongside maybe supplement strategies, or maybe a food-based approach. So let me stop sharing so I can see the chat a little bit better. Yes, Casey says, absolutely, that's that's what she's thinking. I'm sure a lot of you can relate to that too. Like there's this weird thing that we do when we have IBD, and I've done this too, where we kind of want to find that one thing that helps us, but there's no cure for IBD. I know we know that, but then I think our brains kind of want to find that one thing all the time. But it's rarely one thing, even in nutrition. So we're not just saying, okay, take curcumin and that's it. Or we're not just saying, do this dietary strategy and that's the end of the road. It's usually multiple things that we're doing because we're addressing multiple things, right? We're not just addressing one side. We want to increase antioxidants. We want to increase inflammation reduction strategies that we have. So I would say the best thing you could do, if you're able to, is to do both, to have both a dietitian specialized in IBD and also have your doctor alongside you with changing meds, all of that. That would be best case scenario, because nutrition can also help improve the outcome with your medication. So when nutrition works well, that's the side that can be really helpful. When they look at nutrition strategies, they found when it's combined with medicine, it's better than medicine alone. And same with even supplements. Certain supplements even have been tested, medication versus supplement versus together. And oftentimes it's the together part that really, really helps. And we've seen that in our practice too. Okay, so Janine says, if diet plays a role in the development of IBD, did I cause the microscopic colitis? Also, can microscopic turn into UC? Yes, diet is involved in the role of development of IBD, yes, but you have to look at all the different things that are connected with the development of IBD. So it's not just diet. It's also, some things out of our control too, including diet. Diet isn't always in our control, but exposure to antibiotics, especially large amounts, sometimes that's not in our control either. Like we can't just let an infection just take over, right? Sometimes we have to treat that. Low vitamin D is an example. History of using NSAIDs, which are anti-inflammatories like Tylenol and Advil. Yeah, there are lots of different variables. And even diet can somewhat be out of our control. We didn't have control of our diet, when we were kids, for example. I know when I was a kid, I had a lot of fast food in my diet, probably not great. Or finance can play a role in that too. I know there's a time when, I was really struggling financially in college, for example, when I was diagnosed, and food access changed based on my financial situation. So I think understanding the development of IBD is less important because there's no one cause. It's multifaceted. I mean, at the time of my diagnosis, I was an athlete. I ate pretty well. There's so many different variables. So I wouldn't blame yourself if that's where you're headed with that. So no, you didn't cause your microscopic colitis. It's something that happened. There's many different variables involved in that. Also, can microscopic colitis turn into UC? That's a good question. I'm not totally certain on if it can turn into UC. I'm not sure what the rates are of that. I haven't had anybody just yet where it's turned into UC, but microscopic colitis is an IBD. It's just a different type of IBD. And Nicole is, I think you're asking, is fiber okay? Yes, fiber is great. I don't know your specific situation, if you've got any complications or anything going on, but yeah, fiber is really important for inflammation reduction, for helping our microbiome. Alex is asking, how do I do better and manage gas while increasing fiber? Managing and reducing gas. I guess I have a lot more questions to go with that. I guess if we were just going to go with the basics, so starting slow, maybe reducing the amount of fiber and just slowly building up. And then another consideration is if you are increasing fiber, make sure you're also increasing water. So if you were low on fiber, that might cause a little bit more gas or constipation with you as you increase fiber. So something to consider. Things to reduce gas. If it's just mild gas, like, things like peppermint tea, fennel, cardamom, even just chewing on cardamom can help. But if it's a lot of gas or a lot of bloating and gas, then you might want to dig a little deeper to see what else is going on. That might be a different strategy. So there are even certain probiotics that we might use depending on what or all the symptoms that are present. Okay, Karen's asking, do seeds damage your intestines when you have a fistula, especially the ones in fruit, berries, kiwis? Damage, not necessarily damage, but when you have complications like strictures or fistulas, we might change the way we consume a fiber. So we might try to include more soluble fibers and things that completely dissolve in water. We might try to adapt the diet in that direction, but it doesn't mean you need to completely eliminate everything. And it also doesn't mean that it's causing damage. And Alex is asking, my symptoms and stools are so much better when I increase fiber, but the gas also increases and creates other problems and discomfort. What are the other problems that it's causing? Maybe tell me a little bit more about that. Okay. I know you mentioned gas, but is there anything else that it causes? Is it like more abdominal pain? I mean, definitely definitely you want to focus on water. And maybe we need to look at the type of fiber that you're like, what does it look like when you increase fiber? Like that kind of thing. Because yeah, depending on how much and what type, that can change things too. Foul smell and abdominal pain. It's hard to say just given that only those things in the context, but I'm happy to explore it more if you want, like maybe on a call. I don't know on first glance, like where to go with that. I'd have to know what other problems you're talking about too. Yeah. And yeah, if you want to chat with me about it, that's the link. We can kind of try to figure something out. I do have another idea on that, but I have many other questions. All right. Anybody else have questions? Those are great questions, by the way. I don't think I see anything. Collagen supplements. What are you asking about specifically? Like around collagen supplements? Like, is there any research on helping with IBD? I'm guessing that's where you're going. No, there's no research really that show that it helps with IBD that I'm aware of. We've never used collagen specifically for that. There's some There's some research on other things like certain types of collagen for joint stuff, but it's not like super strong. But when you're talking about joint things in the context of IBD, I'd be more keen on trying to reduce inflammation versus trying to use collagen, because you want to look at that bigger picture, like what's driving joint pain or what's driving discomfort. Is it medication side effect? Is it inflammation that's kind of gone to the joints? Then we want to focus on the IBD first, trying to get that under control. Janine's asking about turmeric. Is it a good anti-inflammatory? Depends. So there's turmeric and then there's curcumin. So curcumin is what's studied for IBD specifically. And turmeric is more of like, basically our microbiome likes to consume turmeric. So if you're eating turmeric in the diet, our microbiome likes to consume it, but you won't necessarily get an anti-inflammatory effect, or you'll get minimal effect. But if you're talking about curcumin has some research for helping reduce inflammation in IBD, and they've looked at it next to mesalamine. They've looked at it in a lot of different contexts. And I will say that you do want to know which type of curcumin that you're using. So you want to look at the type that was used in that study, because if you compare curcumin across many studies, it varies a lot, right? So some studies will say that it works, some studies will say that it doesn't. It depends on the formulation. So some formulations are better absorbed than others. So if you're wondering why there's confusion on curcumin in turmeric, those are the reasons, because there's a lot of nuance. We want to know the type that was used, because this one type is effective while this other type is less effective. So that's the variable and why people disagree about it. And yeah, turmeric is more of like microbiome supporting, and you can get that in the diet, but it's not going to be as strategic as an approach as something we might use, to dial back inflammation. And you asked also, does pepper need to be taken with it? Pepper with turmeric can increase absorption a bit. So yeah, if you're doing like a turmeric tea or something like that, it can help a little bit in terms of absorption. Yeah. And then Karen is asking omega-3 and omega-6 supplementation for inflammation. Omega-3s, I think you're asking if they're effective for IBD, potentially, is the question there. Omega-3s, yes. Omega-6s, no. We already get enough omega-6s in the diet already, so we don't necessarily want or need to supplement with omega-6. Omega-3s do help with inflammation reduction in terms of, so you can get this two ways, right? You can get this through the diet or through supplementation. When you're getting it through the diet, you would focus on fatty fish like salmon, halibut, herring, mackerel. And if you're getting it as supplementation, you'll want to focus on a supplement that has a high enough dose. Most of them don't have a very high dose. For example, a lot of them will say 200 milligrams or something like that. The studies on omega-3, usually you want it to be at like the 2 to 3 grams to actually make it effective. And that's in a study with ulcerative colitis. So we know they're pretty effective in UC, but I would say you want to get a specific dose, and you want to make sure that it's in the right context too. So making sure you have a high quality omega-3 is also important. A lot of this, if you're doing supplementation for that, you want to make sure it's one, third-party tested, but two, it's from a reputable company and it has the right dose that will actually produce results. So not every omega-3 will produce results. It's got to be at the right dose. And if you want any recommendations on omega-3s, or you want to talk about what that could look like, I would say maybe schedule a call, and I'm happy to chat with you about it a little bit further. All right. Well, it's been really great getting to chat with you all. And thank you for coming today. I think it was really good conversation, and we will have others like this. So we will have future workshops. So if you're on the email address or the email newsletter, stay on there, and we'll update you as soon as we have a new workshop. But thank you for being here today, and we'll talk to everybody soon. Thank you for the kind notes. Yeah, and feel free to connect on Instagram too. I'm always chatting with people on Instagram. If you're not on Instagram, it's Crohn's _ colitis _ dietitian. That's where I'm at. Feel free to chat there. Feel free to schedule a call. More than happy to chat with any of you. All right, take care.